without anyone realizing, the eye is really clever, and it's continuously having nutrition and fluid entering the back of the eye called the retina to give it everything that it needs. And then it also has waste products and fluid that it doesn't need anymore that is then naturally taken away. As we get older, unfortunately, this process doesn't work as well, and you can end up with everything that's meant to be taken away not being taken away quite so easily. The back of the eye doesn't work as well. You end up with a build-up of debris at the back of the eye, and sometimes the debris can then upset some of the light detecting cells, and the light detecting cells themselves can end up dying off. And we call this process macular degeneration. There's other types of macular degeneration, but the one that I'm going to be focusing on today is age-related macular degeneration, which is typically in patients over the age of 50. So dry macular degeneration is usually found in patients over the age of 50, and it's often quite symmetrical. It might be that you have no symptoms and it's something that's picked up by your optician very early. But if you were to be symptomatic, patients usually experience central blurring of vision or something called distortion. So that's when, for example, if you're looking at the straight line, it would look slightly bent. And many people manage well with early stages of dry macular degeneration, but over time it is a condition that gets worse, and it can eventually lead to reduced central vision to the point where it can affect driving, reading, and other enjoyable activities. So when should a patient seek help? So there's no miracle cure at the moment, unfortunately, for dry macular degeneration, although there are lots of research studies currently being undertaken. What I would advise first and foremost is that smoking is the biggest modifiable risk factor for macular degeneration. So if you are a smoker, please consider stopping. It's also really helpful to have a diet rich in green leafy vegetables. At a certain point, if you reach what we call an intermediate stage of macular degeneration or advanced, then there are some over-the-counter oral nutritional supplements based on what we call the AREDS2 formulation study, and that has been shown to give a slight reduction or progression of macular degeneration. In addition to that, there's a light treatment that is currently out at the moment, which uses something called photobiomodulation. It helps to sort of zhuzh up the mitochondria at the back of the eye, in the idea trying to be to prevent the progression of macular degeneration. It is CE marked, and there are many providers that provide this service. It's quite intense, so it requires 3 times a week for 3 weeks, so 9 visits, looking at a certain frequency of light, just for a few minutes, and it's often undertaken every 6 months. Other than this, there is an injectable management that is available in the United States, but unfortunately it's not available in Europe at present. And the studies that are being undertaken, for example, using stem cell treatment, are not currently available for use. So I was just going to say, when should people look at those options? I would say carry on attending your optician, ask them what the visual acuity is, have a discussion with them about whether it's affecting your quality of life. And at some point you may wish to have a further discussion with an ophthalmologist. But as I said, at present, there's no sort of magic cure for dry macular degeneration. So wet macular degeneration often happens on a background of dry macular degeneration, but the difference is that, as per the name, wet, it's where a blood vessel that shouldn't be there enters the retina at the back of the eye, usually from the blood layer underneath the retina, and starts to leak. So it can leak blood, it can leak clear fluid, and that can affect central vision by causing a sudden reduction of worsening central vision, so worsening blurring and worsening distortion. The way to detect whether you have wet macular degeneration is to test your vision with each eye. So you must cover one of your eyes at each time. And there is something called an Amsler grid, which is a sheet that has lines in a horizontal and vertical fashion with a central dot. You cover one eye, you look at the central dot, and you think to yourself, are the lines around it straight or are they a bit bent and wobbly? And it might be that if you have dry macular degeneration, they might be a bit wobbly to start with, but it's good to know what your baseline is. And I would say maybe once a week or once every 2 weeks, test each eye individually. And if you notice that suddenly one day you do the test and everything looks a lot more bent and wobbly than usual, that is the time to seek urgent help. So within 24 to 48 hours, because only when wet macular degeneration is caught early can it be treated and given the best outcome. The treatment for wet macular degeneration are with injections that go into the eye, and unfortunately they're not a one-off injection. They would start roughly every 4 weeks at the beginning, and then if you respond well, meaning if the fluid is being absorbed and if the vision is stable or better still improving, then we would continue to extend out the time in between your injections. At some point, we would hope that you would get to a period of sort of 3 monthly intervals between the injections a few times before saying everything looks stable, and then we would stop the injections. But wet macular degeneration is typically detected by the patient noticing they have a sudden reduction of vision. And it's really important to emphasize that sometimes with 2 eyes open, you just don't notice something going on in one eye. So you must cover each eye and force yourself to think, how is the vision in each of my eyes doing? So there are lots of different companies out there that offer injection treatment for wet macular degeneration. The drug itself is usually quite similar and can be from the same family of drug, but some drugs will offer additional benefits. So they might be able to act on a higher number of receptors, for example, at the back of the eye than other drugs. The NHS will be able to offer certain injection treatment depending on which trust you're at and what agreements they have locally. But in the private sector, you can usually access any drug that you and your consultant agree is the most suitable drug for you. And this would need to be discussed with your consultant. Patients need to consider the actual giving of the drug itself, and then they need to consider what's in the drug. So the actual giving of the drug, it goes through the white part of the eye, just a little bit away from the edge of where the iris is. And it's given using numbing drops, lying flat, as a little speculum to hold the eye open. You don't really see what's going on because you're looking away from the injection. And then it's put through, as I said, tiny, tiny needle through the white part of the eye. So there's a risk of this causing some bleeding, infection, very, very tiny risk of it causing a retinal tear or detachment. We use it for swelling at the back of the eye, but sometimes it can cause swelling at the back of the eye. It can affect the pressure in the eye because you're giving something into the eye. It can make the pressure temporarily go up. That's the main things to consider with physically having the injection done. But then the drug itself, there is a theoretical link with heart attack and stroke. So I do have patients where they've had heart attack and stroke and I still give the drug. And depending on your consultant, there may be a time interval that they would want to request before giving you this drug again. So there's 2 situations, either someone who's had a heart attack or stroke in the past, in which case it needs to be made very clear that there is this potential link, and they may or may not wish to proceed with the injections. But if they're on the injections and then they have a heart attack or a stroke, it may be that your consultant would wish to pause the injections for maybe a few months before receiving the next one. Again, that's an individual conversation that needs to be had between you and your consultant. So I'd be really happy to see you for a conversation, whether it is surrounding dry macular degeneration or wet macular degeneration. Of course, if you think you have wet macular degeneration, try and book in within 24 to 48 hours. I'm currently working at Spire Bushy Hospital and St John and St Elizabeth's, where I can see you for your consultation. And if the injections are required, I can start those immediately.